Erectile dysfunction is the inability of a man to hold an erection when he is stimulated. It can be psychological, but it can also be physical. The majority of the erectile dysfunction that we see nowadays is physical. It's from pretty much aging of that part of the body, aging of the little nerves, the arteries that bring supply there, but it also can be psychological. And the beauty of the treatments that we have available is that with one spray, they can develop an erection from that. And then that will break that cycle of anxiety that patients can have. And you can slowly wean them off the medication down the track. But without the medication, sometimes it's very tricky to get them back. Adults of all ages can experience erectile dysfunction, but I see it more commonly in men after 40. And specifically at the age of 60, you start seeing it becoming a lot more prevalent. It's a slightly embarrassing topic for the majority of the people. And you need a safe environment, you need time, and you need a doctor who knows you quite well. And I think that's why it fits so well in general practice. I've been treating erectile dysfunction on people who have serious medical conditions, people with diabetes, people who had prostate cancer. And I find that when it's treated in the office, now that I'm a general practitioner, it's much more accessible than when I used to treat it as a specialist radiation doctor. It usually comes at the end of the consultation. They normally have another problem and they just, by the way, I'm having a little bit of trouble with erections. Do you have anything to suggest? And then we normally open that topic. It's never on one quick consult. Usually I break it down in 1 or 2 consults. I think the most exciting thing about SPONTAN is I found that it works really well in patients who have severe erectile dysfunction. I've been prescribing it to a few patients with prostate cancer, and I had pretty amazing results. And I'm finding that a lot of patients who didn't respond to some other current treatments are now responding to SPONTAN.